last presentation for today. I would like to present the results of a small study performed in our CF department that basically aims on short-term effects of Simeox therapy in adult CF patients. So the aim of the study was basically to assess if there are beneficial effects of Simeox therapy when it's used as a mucus mobilization tool in patients with cystic fibrosis. We based the study on three main hypotheses, which we addressed in the study. So the first was if mucus mobilization with Simeox can improve lung function. This was assessed with conventional spirometry. The second was if Simeox can improve diaphragm mobility. This was investigated with an ultrasound-based analysis. And last, we expected Simeox therapy also to affect sputum properties, and we therefore measured sputum viscosity and DNA concentrations in spontaneous sputum samples. We included 21 adult patients with CF. During a stable phase of lung disease, they were recruited when they were seen for a regular checkup in our CF department. And we excluded patients, you see this on the right, with acute infection or exacerbation, also with unstable cardiovascular disease, so patients who had recently pneumothorax or relevant hemoptysis, and also pregnant patients. In the table, you see some baseline values of our study population. So we had mostly young adults with a mean age of 30 years. They were half male, half female. And when we look at the spirometry data, we see, looking at FEV1, that we had a quite heterogeneous group ranging from only 35% of predicted FEV1 to patients with normal lung function. So after recruitment, we of course obtained consent from patients, and they started the first study sessions with ultrasound of the diaphragm, followed by spirometry, and they were asked to provide us with a sputum sample, with a spontaneous sputum sample if possible. Afterwards, they had the actual therapy session with the Simeox device together with a physiotherapist, and after therapy, we did the same examinations again in the same order. So first diaphragm ultrasound followed by spirometry, and we collected a second sputum sample. When we planned the study, we considered that patients first may need some time to get used to the novel device, and therefore all of them joined in a second therapy session within a few weeks, where we did exactly the same with the same workflow. And at the very end, patients additionally completed a questionnaire reflecting their own opinion and experiences with the therapy. Now I want to go just through our main hypothesis and show you the respective data. And we start with the effect of Simeox on lung function parameters. So patients did spirometry before and after Simeox therapy. And when we look at the data here, FVC, FEV1, and MEF 25, 50, and 75, and we compare the values before and after therapy, we found no difference for lung function parameters. Then we come to the second point, the effects of Simeox on diaphragm mobility. Here, I first would like to briefly introduce ultrasound-based assessment of diaphragm mobility to you. It's a method that allows direct functional investigation of the diaphragm. Is it originally known from intensive care medicine? There it's used to assess diaphragm dysfunction in intubated and critical ill patients. However, in recent years, it had also been experimentally used in COPD patients. And there it could be shown that diaphragm excursion correlates with disease severity. And it had also been demonstrated that physiotherapy techniques can improve diaphragm mobility. And in some studies, diaphragm ultrasound was even more sensitive to changes after physiotherapy than spirometry. Therefore, we were interested if diaphragm mobility would also be changed in CF patients after Simeox, as this has not been studied in CF patients so far. So for the measurements, patients were in a lying position with slightly upper body elevation. We waited until they were relaxed and breathing at rest. And then the diaphragm was imaged in the right anterior axillary line. You see this here in the B mode image. You see the liver, and the diaphragm appears as an echogenic structure just behind the liver. And for functional assessment, we did M mode measurements. and they basically reflect the diaphragm movements during breathing. You see here in this MO trace. For each individual breath, we then calculated 3 parameters. So the maximum amplitude of diaphragm exertion and the slope of the amplitude increase during inspiration and during expiration. When we now look at the results and we compare the values of all participants measured before and after Simeox therapy, we see that the maximum diaphragm exertion was slightly but significantly increased after Simeox therapy. The slopes of inspiration and expiration were not significantly affected. But to sum up, the results show that Simeox resulted in certain improvement of diaphragm mobility. Our last hypothesis addresses sputum properties. It's generally assumed that oscillatory devices such as Simeox and others have a kind of mucus liquefying effect and thereby facilitate sputum expectoration. There are some in vitro studies which could show such effects in vitro when they applied oscillations or vibrations on a mucus sample. However, in vivo studies could not clearly confirm this, as those data results are more contradictory. In our study here, we used a microscopy-based assay to assess mucus viscosity. It's called FRAB, stands for fluorescence recovery after photobleaching. I will not go into details here regarding methods, but now you need to know that a half-time of recovery normalized to the half-time of sodium chloride solution, this is what's shown here on the graph on the y-axis, directly correlates with viscosity. And when we look at the results and compare the values we measured in the sputum samples collected before Simeox and after Simeox, we see that there is a marked increase of sputum viscosity. And at first glance, this might appear surprising, as we heard that oscillatory devices are considered to reduce mucus viscosity. However, here we analyzed two separate samples, so we cannot address the question if the direct physical impact of oscillation affects mucus viscosity, but we can say that the samples collected after therapy have different properties, have a higher viscosity than the samples collected before therapy. As a second parameter, we determine DNA concentrations in the sputum. It's well known that mucus DNA is mainly derived from neutrophil granulocytes, and it's also known that a number of neutrophils in the mucus correlates with its viscosity. So NCF and also other inflammatory lung diseases, mucus viscosity significantly depends on the presence of neutrophils. And in our study population, when we look here at the results, we see that in the sputum samples collected after Simeox, DNA levels were higher than in the samples collected before Simeox. We were now interested if elevated DNA levels in our samples also account for increased viscosity. And therefore, here in this analysis, we plotted the difference of viscosity of the samples of each individual patients against the difference of DNA concentrations within the same samples. And we see here that for most of the samples, there's a quite strong near linear relationship. This also was high significant when we did a Pearson correlation analysis. So taken together, this indicates that higher mucus DNA concentrations are likely to contribute or even cause increased viscosity in our samples of Simeox therapy. We think that a reason for this finding might be that mucus after therapy is derived from different lung areas, probably from areas with higher levels of inflammation. So finally, we were interested how our patients experienced Simeox therapy and asked them to complete a questionnaire. I just want to go briefly to a selection of the questions. So when we start at the top, we see that there was moderate to strong agreement that Simeox can be an efficient form of airway clearance. They were ambiguous if Simeox helps to remove mucus, especially from deeper lung areas. And they all agreed, there was strong agreement, and Simeox therapy was easy to operate, and that they could use the therapy self-dependently. When we come to questions aiming on side effects. No one indicated having pain during the therapy, and only a minority reported some kind of exhaustion or tiredness related to Simeox therapy. Overall, 2/3 of patients, 66%, indicated that they would recommend it also to other CF patients. We also asked as kind of as free text style questions what they like most and dislike most about Simeox, and here you see the most frequent answers. So what they liked most, they answered that some experienced better mucus mobilization immediately or within the next hours during the same day, and that they had easier breathing. Some appreciated especially that it is a passive technique which does not require own effort and that it's easy to use and to operate. When we asked what they disliked most, the most frequent answer was that the device is quite loud and quite large and unhandy. So I think that patients thought about if they would have it at home. Yeah. So to summarize, we had no adverse events in our study related to therapy. So it appears to be a safe airway clearance method. We found no short-term effects on lung function parameters. However, we found increased diaphragm mobility, better diaphragm mobility after Simeox. The sputum we collected after Simeox therapy was more viscous than the one before, and this correlated with an increase of DNA levels. And therefore, we assume that sputum after Simeox therapy is derived from different lung areas, probably with higher levels of inflammation. According to the patient's experiences, Simeox appears to be well tolerated and easy to use after professional instruction. And of course, to see if there are advantages of Simeox over the established airway clearance methods. Of course, we need further controlled studies also to monitor long-term effects and maybe to identify the subgroups of patients who will benefit most from Simeox therapy. So I thank you for your attention, and I'm looking forward to the discussion.